A troubling trend has emerged during the push to vaccinate people against COVID-19. Some folks are getting billed for their free shots. So we have attorney Ashish Mundru joining me live now. Good morning. So COVID shots and tests are supposed to be free, right?
Absolutely. They're supposed to be free, Sally, and good morning to you.
Okay, so what should people do if they get a bill?
Well, what people should do is first make sure they ask their provider if they're going to a private medical doctor or facility, hey, are there going to be any charges associated with this shot? They should say no. In case they receive a bill after the shot is administered, then they need to call and write to them, because documentation is always key, to ask, hey, why am I getting charged for the shot? If the shot is associated with other medical services, for example, you went for your annual checkup and you also got the jab, then they will charge you for the annual checkup, but they can't charge you for the shot. The federal government paid billions of dollars for these shots for all of us to receive them. The last thing we need are scammers taking advantage of the system to charge us for the shot when they shouldn't be able to do that.
Right. So what if, you're having a hard time getting this taken care of and the company trying to charge you just is not backing down? What do you do then?
Well, there are multiple avenues of relief for that issue. One, you can go to the HHS, Health and Human Services website, and they have a hotline number there. I believe it's 1-800-HHS-TIPS. Report them there. Second, you could always contact an attorney and have them address the issue. And third, the Center for Medicare Services also has a hotline and a website portal where you can report these types of fraud and abuse issues with charges that are unjustified, unnecessary, and potentially fraudulent.
And you said there's really no reason, right, that anyone should get a bill after a shot unless it's tied to you going in for like your well examined. Any other reason why people might be getting billed?
Well, unfortunately, as we've seen through COVID, the space has been ripe for fraud, abuse, and people scamming. We saw that with the masks. We saw that with testing. And of course, now we're seeing it in the next iteration with vaccination. So be on your guard, ask the questions as you go in, ensure that the charges are not tied to other medical services. And if you do end up getting a charge, there are avenues to get you that relief.
Okay, we don't want that to happen to anybody. Thank you, Ashish Mundru, attorney. Thank you for joining us. Appreciate it.
Thank you.